Hey folks, welcome back to Shock Doc Medical. I'm your host, Dr. Rod, and today we've got an awesome deep dive into a brand new clinical risk score for vertigo. Now, vertigo is one of those tricky complaints that sends doctors on a wild goose chase. You know, you're in the ER, dizzy patients left and right, and you're trying to figure out, is this something benign like BPPV, benign paroxysmal positional vertigo, or something more sinister like a stroke? I've definitely been there. Sometimes it can feel like hunting for a needle in a haystack. But fear not, friends, because we might have a new tool to help cut through the confusion. All right, let's do this step by step so we can really dissect this paper and talk about what it means for us docs in the trenches. So, the paper is about developing the so-called Sudbury Vertigo Risk Score. It's basically a way to figure out how likely it is that someone with vertigo has a serious cause like stroke, TIA, or even brain tumor. Apparently, only 2 to 5% of vertigo patients have something major going on, but we often end up imaging a ton of them with CTs and MRIs, which is expensive and sometimes still misses stuff. They did a 3-year prospective cohort study across 3 big Canadian EDs. Over 2,000 patients with vertigo or dizziness were enrolled. Kinda huge, right? They looked at who ended up with serious diagnoses like stroke, TIA, vertebral artery dissection, or brain tumor, and then they dug into the clinical variables that might predict those outcomes. Turns out around 5% had a serious cause, 111 patients. The researchers used logistic regression to come up with a 7-item score, which includes risk factors like being male, over 65, having hypertension or diabetes, plus certain neurologic deficits. If you total up the points, you get a sense of how likely it is this person's got a dangerous problem. At one end, you've basically got a 0% chance if your score is really low. At the other end, it could be as high as 41%. Pretty wild, right? In a nutshell, this Sudbury Vertigo Risk Score could be a game changer, if it's validated, helping ED docs decide who needs that immediate imaging and who can potentially skip the scan. Prospective, multicenter. This is strong stuff. They did phone follow-ups at 7, 30, and 90 days. That's thorough. One potential limitation, though, these are all big tertiary care centers. So can we apply it to rural or smaller hospitals? They use logistic regression and bootstrap validation, both pretty solid approaches. The big question is always whether the variables they chose are truly the best ones, but they did their homework with a scoping review and expert opinion. The sample size is large, which is awesome for reliability. They also mentioned that the adjudication committee was blinded, which helps cut down on bias. As with most ED-based studies, they lost about 20% to follow-up, and not all patients got immediate MRI confirmation. Plus, we still need an external validation study, so definitely some caution needed. We already have tools like HINTS, Standing, and a few others, but they often require specialized neurology skills or have lower sensitivity when used by non-neurologists. This new score aims to be more straightforward. To me, this is huge for any frontline doc. It helps stratify risk and might reduce unnecessary scans. Also, if validated, it could help standardize care so we're not missing those nasty strokes. If it does get validated, we could see guidelines recommending the Sudbury score as a standard step in vertigo assessment. That could shape policy and reduce healthcare costs. So, doc to doc here. How do we incorporate this into our day-to-day practice without adding yet another form to fill out? Will this really cut down on CT use if everyone freaks out over missing a stroke anyway? I'd love to hear from anyone who's tried implementing a risk score in the ED. Does it simplify your workflow or add more layers of complexity? Let's keep that conversation going. For the future, we'll need a prospective validation. But if everything checks out, we might see a day when your triage nurse is already computing a risk score. That'd be pretty neat, right? All right, folks, that's a wrap for today on Shock Doc Medical. If you enjoyed this chat, make sure to subscribe, share it with your colleagues, or anyone who's curious about the latest in emergency medicine. As always, keep saving lives, keep asking questions, and I'll catch you in the next episode. Stay curious and stay awesome, everyone. Later.